The effects of singing bowl sound meditation on mood, tension, and well-being, an observational study. This was printed in Sage Journals, a journal of evidence-based integrative medicine. Abstract. Poor mood and elevated anxiety are linked to increased incidences of disease. This study examined the effects of sound meditation, specifically singing, Tibetan singing bowl meditation, on mood, anxiety, pain, and spiritual well-being. 62 women and men, mean age 49.7 years, participated. As compared with pre-meditation, following the sound meditation, participants reported significantly less tension, anger, fatigue, and depressed mood. Additionally, participants were previously naive to this type of meditation experienced a significantly greater reduction in tension compared with participants experienced in this meditation. Feeling of spiritual well-being significantly increased across all participants, and Tibetan singing bowl meditation may be a feasible, low-cost, low-technology intervention for reducing feelings of tension, anxiety, and depression, and increasing spiritual well-being. This meditation type might be especially useful in decreasing tension in individuals who have not previously practiced this form of meditation. Heart disease, diabetes, addiction, and mental health issues have all been linked to stress and tension. Meditation includes systems such as mindfulness-based meditations, has shown promise in inducing the relaxation response and helping alleviate anxiety and improve well-being. The relaxation response is the body's physiological response in relaxation, included lowered blood pressure to counter the fight or flight response, and activation of the parasympathetic nervous system. As promising as mindfulness and other meditation systems may be, a common complaint is the time, patience, and discipline required to learn meditation. Thus, a form of relaxation and stress relief that does not require a steep learning curve or a great deal of discipline to utilize could potentially be a huge benefit to human wellness and health. The authors set out to examine the possibility that merely lying down and listening to the high-intensity, low-frequency combination of singing bowls, gongs, and bells in a sound meditation could induce a deep relaxation response and positively affect mood and sense of well-being. Sound healing has been used for centuries and has been utilized in various forms by cultures the world over, including native peoples. Australian Aboriginal tribes have used the didgeridoo as a sound healing instrument for over 40,000 years. Ancient instruments have also been used for religious and spiritual ceremonies, such as Tibetan, also called Himalayan, singing bowls. Tibetan singing bowls are metal bowls, usually consisting of a combination of metal alloys, and originally used by Tibetan monks for spiritual ceremonies. While sound healing is not a new concept, there is a paucity of research in areas such as Tibetan and quartz crystal singing bowls. The majority of singing bowl studies relate to the physics of these musical instruments, including the sonic and wave properties, as well as attempting to model the singing bowl's acoustic characteristics. In one study, singing bowls were used for emotional healing with high-risk youth as part of what was termed the best visualization method. The bowls were used in a psychotherapy model in combination with deep breathing, visualization, and a loving-kindness meditation. The authors reported that this combination of healing methods may be a catalyst for emotional and psychological healing and counseling sessions. The purpose of the present study was to further advance research in this area by examining the possible effects of singing bowls and sound healing on mood, anxiety, physical pain, and spiritual well-being, and to lay the foundation for a future, more formal, randomized control trials. Sound meditation protocol. Participants were instructed to bring yoga mats on which to lie down, and if desired, a pillow and a blanket for the sound meditation. Participants were asked to lie down in a half circle or an oblong shaped configuration, depending on the size of the room and the number of participants around the room, with their heads pointed towards the musical instruments, which are placed on the floor near their heads. The musical instrument consisted of Tibetan singing bowls, crystal singing bowls, gongs, tiny cymbals, bells, didgeridoos, and other small bells. The majority of the Tibetan singing bowls, approximately 90%, consisted of a large size jambati, which ranged in size from 9 to 12 inches and ranged in weight from 3 to 5 pounds. Approximately 5% of the singing bowls were very small bowls, approximately 4.5 inches in size and weighing 0.5 pounds. The remaining 5% of the singing bowls were very large bowls, ranging in size from 12 to 14 inches in size and weighing 6 to 8 pounds. The singing bells were the primary instrument played during the meditations, played for approximately 95% of the time, while the individual instruments were played for approximately 5% of the meditation session. The major method of creating sound and vibration with the singing bowls was by tapping or striking the bowls with the mallet, which was used approximately 95% of the time. Between 30 and 80 Tibetan bowls, 2 and 3 crystal bowls, and 2 to 6 gongs were used, depending on the number of participants. Thus, participants in the CIHS and the Chopra Center listened to approximately 25 Tibetan bowls, 2 crystal bowls, and 2 gongs, while participants in the Seaside Center listened to approximately 80 Tibetan bowls, 6 crystal bowls, and 6 gongs. Each participant had at least 2 Tibetan bowls near his or her head. The bowls were struck with a cloth-covered wooden mallet called a puja stick. The instruments were all played in a regular sequence, and the duration of the sound meditation was approximately 60 minutes. Additionally, Tibetan metal bowls were placed in the center or near center of the room, and the bowls were in turn struck by a mallet and rubbed along the rims of the bowl, creating a distinctive sound which was allowed to trail off. Additionally, several quartz crystal bowls were placed near the center of the room and were played by rubbing the rim with a felt cloth-covered mallet, and the sound trailed off after playing the bowl. At the beginning of the sound healing meditation, the lead musician spoke to participants in a soothing tone. He instructed participants to lie down, and if they wished to fall asleep, they were allowed to do so. He then told them to merely observe any sensations they felt in the body during the meditation without judging them, and to simply relax and enjoy the meditation. Then the sound meditation began. At the conclusion of the meditation, the lead musician instructed participants to gently become aware of their surroundings. Participants were also instructed to take their time in readjusting to a state of awareness. Discussion. This was an observational study designed to examine the potential effects of a singing bowl meditation on mood, tension, anxiety, physical pain, and spiritual well-being. A significant difference was found at all endpoints examined in response to the meditation. The tension subscale in particular demonstrated highly significant effects for participants post-meditation, thus providing support to the hypothesis that a sound meditation would increase feelings of relaxation and decrease feelings of stress. Additionally, depressed mood and anxiety scores on the HADS were significantly reduced post-meditation compared with pre-meditation. Moreover, scores on the FACIT revealed increased feelings of spiritual well-being as well as faith immediately following the sound meditation. Thus, while less desirable mood states such as tension, anger, and depression decreased following the meditation, potentially desirable variables such as sense of spiritual well-being increased. Interestingly, previous experiences with singing bowl meditations and lack thereof also appeared to be a factor in the effects of the meditation. Participants who were previously naive to this meditation demonstrated larger effects than those who were experienced in these meditations. An unexpected effect was discovered to a significant mean change in the tension subscale from baseline to post-treatment for participants in the age group 40 to 59 years. Those participants in this age group who were previously naive to singing bowl meditations had a significant reduction in mean tension from baseline to post-treatment, indicating a dramatic effect of the meditation. On the other hand, bowl experienced participants in the age 20 to 39 years old reported a significant reduction in the tension subscale post-treatment. Participants aged 40 to 59 appeared to especially benefit from the sound meditation. This age group demonstrated the largest reduction in physical pain and a strong reduction in tension, especially for those who were previously naive to this type of meditation. Thus, a follow-up sound meditation study might examine this age group in more depth. The reason for the beneficial effect of singing bowls is unclear. However, various theories have been proposed. One theory includes the potential effects of binaural beats, in which the brain entrains to the hertz difference between the tones played in each ear, propelling the brain into deep wave states of deep relaxation, such as beta waves or even meditative or trance-like brainwave states and theta waves. In addition, potentially the action of sound waves on the purported field or energy field of the body could be a factor. Such theories may begin to characterize the potential effects on mood, as well as physiological changes associated with singing bowls. Physical healing was the goal of a study that utilized blood pressure data in relation to a singing bowl. This study attempted to quantify the sonification of blood pressure through three-dimensional imprinting, designing, and fabricating of a singing bowl using blood pressure data. Allen and Shealy examined the use of a single quartz crystal singing bowl on participants' electrodermal responses, the body's electric responses, to toning and playing the crystal bowl. The authors recorded electrodermal responses of 40 acupuncture meridian points on participants' left hands and right feet, which demonstrated increases and decreases, respectively, in electrical responses to playing the crystal bowl. Another study examined the potential effects of quartz crystal bowl playing on perception of pain and revealed mixed results. In a recent randomized crossover study, playing a single Tibetan or Himalayan singing bowl was found to decrease blood pressure and heart rate more than silence alone, when conducted immediately prior to a guided visualization. Participants who listened to a singing bowl had a lowered score on the positive and negative effects schedule, a measure of effect and mood, than meditation alone, but had comparable PANAS scores to the silence-only group. There were limitations with the present study. The most notable limitation was that this was a non-randomized observational study without a control group. The study does, however, provide the groundwork for future research regarding the effects of singing bowl meditations on assessments of stress and well-being. As discovered by Landry, this low-tech form of meditation may have the capacity to lower blood pressure and heart rate, and there are potential benefits to cardiovascular health that have yet to be further explored. The results provide promise for a form of stress reduction that does not require the individual to learn a disciplined form of meditation. In fact, the participants may even fall asleep if desired. And at the very least, participants generally express feelings of deep relaxation and inner peace following the sound meditation. Moreover, those in health professions, such as nurses and counselors, could easily provide these meditations to patients. While it may require a very minimal amount of practice, Extensive training is not necessary to learn to play the singing bowls and other instruments. One merely taps or rubs the bowls gently with a mallet. Thus, this type of meditation could be taught to health and counseling professionals and provided in an almost unlimited number of settings to induce the relaxation response, reduce stress and potentially stress-related disease in the body. In summary, this observational study found significant beneficial effects of Tibetan singing bowls on a number of markers related to well-being. Future randomized control trials are warranted to further examine the effects of these meditations on mood, well-being, and physical pain. In addition, future research could explore the meditation's effects on various age groups in more depth.